Hi, this is Michael Altos, and we're continuing our discussion of herbal medications and dietary supplements, and this is recording part 2. Garlic is taken because it inhibits platelet aggregation. People take it to prevent MI or stroke, as well as to lower blood pressure and lipids. Because of its effect on platelets, it can increase risk of bleeding, especially in patients who are taking antiplatelet or anticoagulant meds, and garlic should be stopped 7 to 14 days prior to surgery. Ginger inhibits serotonin pathways as well as platelet aggregation. It is used to prevent nausea and for its anti-inflammatory effects, but we see an increased risk of bleeding, especially in patients taking antiplatelet or anticoagulant meds. There's no data on when this drug should be stopped, but most people would recommend stopping it at least a couple days before surgery. Ginkgo biloba inhibits the platelet activating factor. People take it to treat claudication, which is like anginal pain in the extremities with exertion. It should improve blood viscosity and increase tissue perfusion. It's also an antioxidant and may prevent dementia. Ginkgo increases risk of bleeding, especially in patients who are already taking other antiplatelet or anticoagulant meds, and can also cause GI upset and headache. It should be stopped 1 to 2 days prior to surgery. Ginseng is a sympathomimetic drug. It also inhibits platelet activity, lowers blood glucose, is a mood enhancer, and an antioxidant. Ginseng can increase risk of bleeding, especially in patients who are already taking antiplatelet or anticoagulant meds. However, it may decrease the effect of warfarin. Patients may experience tachycardia or hypertension when taking ginseng because of its sympathomimetic effects, and it can lead to sleeplessness and mania. There is some risk of hypoglycemia, and it may interact with MAO inhibitors. This substance should be stopped 7 days prior to surgery. Grapefruit juice inhibits cytochrome P subgroup 3A4. People take it for cardiovascular health, but because of its effect on the cytochrome family, it can prolong the effect of many drugs, including antihistamines, calcium channel blockers, midazolam, lidocaine, warfarin, digoxin, HIV drugs, cyclosporin, and many others. There's no data on if or when you should stop grapefruit juice, but we should be aware that patients may see changes in how their drugs work, either when they start the grapefruit juice, or if they suddenly stop taking it. Green tea inhibits platelet aggregation. It also contains vitamin K and may function as a diuretic. Patients take green tea to help with weight loss, mental alertness, cancer prevention, and as an antioxidant. It can increase the risk of bleeding, especially in patients who are taking antiplatelet or anticoagulant meds. It may also decrease the effect of warfarin because it contains vitamin K. It should be stopped 7 days prior to surgery. Kava potentiates GABA, and therefore it acts as a sedative and an anxiolytic. It also potentiates other sedatives. Does kava require us to give more sedation and increased anesthetic requirements due to chronic use versus patients coming in already sedated because of the kava they're taking? And so we have to assess the patients and see what kind of effect they're having and how long they've been taking the substance. Patients can develop dependence as well as abuse and withdrawal when it comes to kava. They can also have hepatotoxicity. Patients may develop a dystonic-like reaction or a Parkinsonian reaction. In general, we recommend stopping it at least 24 hours before surgery, with the understanding that people who are chronic users may have issues with withdrawal. St. Johns Wort, or hypericum, induces cytochrome P3A4. It also inhibits reuptake of serotonin, epi, norepi, and dopamine. People take it to treat depression or anxiety. Side effects include sedation or hypomania, serotonergic crisis, and decreased plasma levels of many drugs because it induces cytochrome P450. This drug should be stopped 5 days before surgery. Saw palmetto is thought to block the conversion of testosterone. People take it to treat benign prostatic hypertrophy. Caution should be used in patients who are taking anticoagulant or antiplatelet drugs. There's no clear data on when this drug should be stopped prior to surgery. Valerian potentiates GABA, and so it's used as a sedative or an anxiolytic, and potentiates other sedatives as well. Once again, we need to think about, are patients going to come in sedated versus have an increased anesthetic requirement because of chronic use? And consider the possibility of dependence, abuse, or withdrawal. Data is not clear on when valerian should be stopped. Some have suggested 2 weeks before surgery. That's the end of this discussion on herbal medications. Please let me know if you have any questions, and we'll see you next time.